When facing a surgical procedure, the last thing you need to do is hassle with the healthcare system. But here in the Quad Cities, there is an alternative. News 8's Katrina Owens joins us with more.
There's a lot more to quality health care than just high prices, bureaucratic red tape, and worrying about how to pay for everything. The Mississippi Valley Surgery Center in Davenport is an outpatient facility performing procedures that you would think required hospitalization. You're about to meet a woman who had a total hip replacement, was home in hours, recovered in days, and is physically more active now than before surgery.
Major pins and needles in the front part of my groin where my hip is connected into the pelvis area, but sharp, excruciating pain that would shoot down to my foot.
Now 46-year-old Beth Sranglao is active again, playing basketball with her son Jonah and running. But 2 years ago, Beth could barely walk because of a worn cartilage in her painful right hip. As a mother and teacher, downtime from a total hip replacement was not an option. But after meeting surgeons at the Mississippi Valley Surgery Center, Beth realized a minimally invasive total hip replacement was possible.
It was at 4:30 I finally got in. I left the surgical center at 9:30 the next morning. And it was wonderful.
Here at the Mississippi Valley Surgical Center, not only are all of the doctors board certified, but as with Beth's surgeon, Dr. John Hoffman, he is also fellowship trained in sports medicine.
You're in an environment which does not have sick people with bad bugs resistant to lots of antibiotics. And so presumably if there's an infection, you're a little less likely to get a more typical hospital-acquired bad bug.
Orthopedic surgeon Dr. John Hoffman says there are many reasons to have surgery at an outpatient facility. Germs are one. Cost is another.
The Iowa Hospital Association has reported that the average cost of a total knee arthroplasty in this area is between $28,000 and $36,000. The cost at the Mississippi Valley Surgery Center is about $18,000.
And as the case with Beth, it was imperative to get back to normal activity as soon as possible. Dr. Huffman says that's another advantage to the surgery center.
We're much more clever about using a spinal anesthetic, for instance. We use local anesthetic. We use different pain medications. We stay away from the IV, very sedating narcotics.
And according to Beth, there's nothing like getting high-quality care and one-stop shopping.
The doctor's office is in the same building in Davenport, and the surgical center is right down below, and then I'd chosen to do with physical therapy on site as well. So they were all three in one spot.